everyone, welcome back again to my channel. My name is Folakemi. How are you doing? I hope you're doing great. Today I'll be talking about stroke. Yes, stroke. What comes to mind when you hear the word stroke? Drooping face, disability? Yes. According to the Center for Disease Control and Prevention, stroke is a leading cause of death in the United States and also a leading cause of disability in adults. The fortunate thing about stroke is preventable and it can be treated. It's treatable. Today I'll be talking about the types of stroke, the signs, and the treatment options. First of all, what is stroke? Stroke happens when there's a blockage to the brain. Yes, we all have a brain in this skull. We all have a brain in our head. Like you and I, we eat to sustain ourselves. The brain also needs oxygen to function very well. The brain is used for our emotions, our thoughts, talk of anything, for breathing, digestion, anything that you're doing, the brain controls it. Your language. So when there is a blockage to the brain, when the blood vessel cannot carry oxygenated blood to the brain, a stroke happens. There are two types of stroke. The first one is ischemic stroke, which is the most common type of stroke. This occurs when a blood clot happens in a blood vessel that carry blood to the brain. When the brain doesn't get that blood supply, it starts dying in minutes. And that is why they say you should take a fast act. The second one is hemorrhagic stroke. From the name hemorrhagic means there's a bleeding somewhere. A blood vessel bursts and there's a bleeding in that area. There's also one we call TIA, which is also called as known as mini stroke. And this happens when there's a blockage within like 5 minutes. So people will have mini stroke and they will come back to normal. What are the signs that can tell you that someone is having stroke? When you look at the face, is the face drooping? Is the individual able to smile when you ask them to smile? What does the hand look like? Is the hand on one side? Is the patient able to maintain a balance, and is one of the hand drooping to one side? The speech is the S1. When you ask the patient, I kept saying patient, I'm so sorry. When you ask the individual to talk, is the person able to talk? Is the person able to communicate? Is the language slurred, or can the person talk to you correctly? And the last portion of the FAST is T, which is time. Time is very important when it comes to stroke. If you're able to take the patient or the individual to the hospital within 3 hours, they will be able to administer a medication called TPA. It's a thrombolytic. It helps to break down clots. If they're able to give the individual that medication, it can break down that clot and that patient or individual can come back to normal. So fast. The face, is it drooping? Is the individual able to smile? Is the individual able to communicate? Arm, is the arm drifting to one side? S, is the language slurred? Is the person confused? Does the person understand what you're telling him or her? And the time. So you have to act fast. Act fast for you to prevent stroke from causing a permanent brain damage or a permanent disability on that individual. You can take healthy lifestyle by working with your primary care physician on maintaining a proper blood pressure, taking your medication, managing your blood sugar, maintaining a proper cholesterol level, eat a healthy diet, quit smoking. And if you're planning to smoke, please do not smoke. Quit alcohol taking. Maintain a normal body weight and exercise daily. I hope this little teaching will help you recognize the signs and symptoms of stroke, and it will help you to take action when you see something, when you see a patient or an individual experiencing signs and symptoms of stroke. Till I see you again, I remain your friend, F.A.S.T. Please remember to subscribe, to like, to comment on this video. Till I see you again, bye. Thank you for watching. I'll see you later.